Dee, this is the video for mobilizing the first rib, which does 7 things. And this technique, everyone just loves it because everyone thinks the rib moves up and you got to pull it down. And in fact, it oftentimes is a transverse plane restriction. So it's really simple. What you do is pinch someone right in the thickest part of the trap. It feels absolutely natural. And 1 finger below that place is the knuckle of the first rib. And it feels like a little pinky knuckle. And if you're unsure, just make circles around that area, about a half inch diameter. And you'll find that you're on the money there. Okay? So what you want to do is capture it with a couple of fingers. And 3 fingers is okay. You can put them together like that. You'll absolutely be sure to be on it. And you'll be able to tell a side-to-side difference in feel. And it will feel prominent when it's dysfunctional. And you won't be able to spring it forward. Okay? What you do is you engage it with a couple of fingers. Okay? And you distract it off the transverse process. So I want you to imagine that the table that I'm laying on is in the very middle of the room, and it's elevated to the very middle of the room. Okay, so just hold that image, and then it'll make the rest of this explanation very simple. You want to lift that rib off the transverse process and the vertebral body. So you lift it, typically with your left hand, and you lift it at a 45-degree angle towards the uppermost corner, the uppermost right corner of the room. And you give it about 30 seconds of effort. So you want to really just take the slack up out of the system. And at that point, then you're going to add a lateral vector. Because what you want to do is you want to gap the joint, and then you actually want to close it in the back, and you want to pull it outward in the front. So you continue with that vector, that 45-degree vector, and then you come with your right hand and you just go up the axilla and up that deltoid crease, and then you fall laterally and capture the acromion. So what you want to do now is push the acromion gently at a 45-degree angle towards the lower corner of the room, down there where the wall, where the floor and the wall meet. Okay? It is that easy, and just hang out for about 1.5 minutes or 2 minutes, and it's really a really sweet kind of a release. And I think that if everyone treated each other, the world would be a lot more sane. It's just really one of those key areas where people hold so much tension. So I hope that makes sense. If it doesn't, let me know. Thanks.